without further ado, we have our speaker from Hospice of Humboldt. Anybody introduce her?
I can introduce myself.
Awesome. Do you want to push the buttons too?
I'll push the buttons too. Hi, everyone. It's so good. Hello. It's so good to see some familiar faces in the room. And also, I just want to let you know that I bought a ticket to Oktoberfest. I felt the pressure. I put on enough events in my career to know the pressure. And I don't eat very much meat, so don't buy in the food. It was just a straight donation. I also know that that is best as well. So anyways, I'm Tia Baratelle, the Director of Development for Hospice of Humboldt. Thanks so much for giving us the opportunity to talk a little bit about what we do. I'm sure almost everybody in the room, if not everybody, has heard of Hospice of Humboldt. You just took a picture. I like to smile.
I always get people when
Exactly. I'm gonna see that photo someday. I'll be like, oh. Okay. So I'm sure many of you have heard of Hospice of Humboldt, very well known in our community since we're the only hospice organization. We are also doing palliative care, which I will talk a little bit more about here. And just want to touch on, I know time is kind of running out. You all are very busy people. I commend you all for being up this early and doing all the amazing work that you do in the community. So I'm going to kind of move along. I just like to share some of our amazing staff. They are truly just at our organization for all the right reasons. Many of them, you know, RNs, they could be getting paid a lot more if they were working in the hospitals, but they truly enjoy the work that they do and really do it because of, you know, that people need hospice care at end of life. And I mean, it's why they went into, you know, medical field in the first place, and they really find the joy in it. And also there's our new CEO, Diane Keating. She's the one bottom right. She's been with the organization for over 21 years as our Director of Finance and Business Operations. And we're just so excited that she is our newest leader as of a couple months ago. So she's awesome and amazing. So just a little history. We've been serving our community since 1979. It was an all volunteer ran organization up until 1989 when it became Medicare certified, which means that we could start billing Medicare, which means we could have more money to hire more staff and be able to serve more people in the community. A pretty large capital campaign happened in the 2000s and kind of wrapped up around 2015, actually still bringing in a few donations of people who pledged to the capital campaign, which is awesome. It was all kind of mission driven project where we wanted to build a hospice house. We're very lucky to have a hospice house in our community. It actually very few hospices in California have a hospice house, and there are none in any rural areas like ours. And if you haven't seen the hospice house, I welcome you to come to campus. I'll give anyone a tour. It's beautiful. It's set in the Redwoods, and I think there's a picture of it. So we just also are starting a new program, which is our home-based palliative care program. It's a little different than some of the palliative care programs that currently exist in Humboldt County, where we're actually doing home visits. Most of the other services are just, you know, just telehealth. And a palliative care, which I'll talk a little bit more about here in a moment, is kind of the, you know, not quite folks that are ready for hospice care yet, but are still seriously ill in our community and could really use the extra support of a team. Oh, so I just like to show off this picture because this is where we started. And this is where we are now. So that's what I was just talking about. So we have our, administration building, and then the hospice house is in the middle. And then we have the Chapel of the Redwoods, which is available to all the families that we serve, and they can use it for memorial services. We've had weddings there. It's just really beautiful. Again, come by for a tour. Let's see. So we serve a 50-mile radius from Eureka. That's pretty common with hospice because we're 24/7, 365-day organization, and we have to be able to reach our folks at any time when they need us. So our current average daily census is about 130 patients. So those are folks that we're serving in their homes or wherever you call home. So we go out to skilled nursing facilities and residential care facilities as well. This also includes our palliative care patients and folks at the Hospice House. We have about 100 staff and nearly 100 volunteers, and certainly cannot do the work without their support. Totally local nonprofit, which is pretty rare in healthcare these days in Humboldt County. So we're pretty proud of that. Let's see. So just kind of the basics of, hospice. I think one of the big misconceptions is that you don't need a referral. Anybody can call up hospice and we'll come out and do an assessment and see if it's the right time and, the right program. And also, I think a lot of people think of hospice as in the final days or final week of someone's life. And really, we could be serving families for so much longer. And that's one of the biggest things we hear from family and loved ones is, I wish we would have called sooner, that we could have really been using that support for, many months leading up. So it's just a huge team. I mean, that was one thing I didn't have before coming to hospice. I didn't have, the real life experience, and I really did not understand how much went into the care that we provide. It's just this big team of folks and meet weekly and talk about patients, and it's really incredible. So shout out to all of those folks. So that's our hospice house again, and so there's several reasons why we wanted to build this hospice house and have it in our community, because before, when people were at home and they wanted to, spend their final days at home, if there was any complications or having trouble, controlling pain management or, their symptoms, the only place they could go was the hospital. But now we're able to bring folks to the hospice house and get their symptoms under control, and then they can go back home. It's also a place for respite for families and caregivers. I mean, that's a big deal. It gives them a break. And so we can bring folks in for respite. People have weddings to go to, or they want to take a vacation, they need 24-hour care for their family members. And then also some people decide they want to stay at our hospice house until the end of life. So just a little more on palliative care. So we enrolled our first patient in mid-April, and we have about 25 patients currently on service. These are folks that, so with hospice, you have to have a 6 months prognosis left to live, and palliative care, we can, extend that time. It is also totally mission driven because very few payers pay for palliative care. So only partnership, which is Medi-Cal and, our area is called Partnership, actually reimburse for palliative care. But we really saw the need in our community, and same with the hospice house. The hospice house also does not pay for itself because it's incredibly expensive to run, which is one of my jobs as the development director, is to bring in money for that, as well as this new palliative care program. We've been overwhelmingly generous from our community, as I've been trying to raise about $500,000 in about a 2-year span, and we're up to about like $360,000. So just a little bit more left to raise, and I mean, it's truly going to be a really good thing. And we're already hearing that from families, like, oh my gosh, this is just a tremendous amount of support. Because what happens is you're seriously ill, you end up in the hospital, then you get sent back home, something else goes on, and then it's, you know, a revolving door. And we're really trying to stop that by getting to folks as soon as they leave the hospital, then we can be there to support them. They have this like bag of medication and they're like, oh my gosh, what do we do? And I'm supposed to go see this specialist and that specialist. And so the palliative care team really helps coordinate that care, which we all know, I mean, you know, navigating the healthcare system is difficult enough, let alone, you know, when you're seriously ill or a family member is seriously ill. So it's really great to be able to kind of hold on to these folks and walk them through the process. And then when they're ready, because you can also be seeking treatment still as a palliative care patient, which is different from hospice care, but it also helps that transition easier because when some folks come on to hospice care, they get better. Because they're getting support. And so before we would have to, for lack of a better word, kind of like kick them out of hospice. And, you know, and it was still, you know, that was really hard to do, but now we can transition them into our palliative care program and then move them back into hospice care when it's appropriate. All right, somebody give me a time. I don't want to take too much time here.
3 more minutes.
Okay. So I'm going to go ahead and just kind of move through these slides because I did bring materials. So if you're curious a little bit more about palliative care and who qualifies as well as hospice and the Hospice House, I'm just going to leave that up there. So how we're supported is we are covered by Medicare and Medi-Cal and private insurance. However, our organization goes above and beyond and does all these other things that are not reimbursable, which is why we are out in our community asking for support. We also, the hospice shop is not far from here. If you are aware, it's right here on 6th Street. And it's amazing. And we get some revenue from that. And so any donations made to the hospice shop and anything you purchase helps our organization. And just why support matters. We offer grief support services. I totally didn't touch on that, but not only for our hospice and palliative care patients and families we serve, it's open to anyone in the community. We're also able to serve people that are farther out because we've been doing grief support services by Zoom. So that's another great resource for our community. And I don't need to tell you how to get involved. You're all amazing volunteers and you do great work. But really, you know, we have lots of volunteer opportunities if you are interested in getting to know hospice better. Of course, just talking with family and friends. A lot of people don't like to talk about death. And, you know, it's going to happen to every single one of us. And so I think we need to just talk a little bit more about it and, you know, find out what is out there and how we can be supporting our families and loved ones. And of course, I wouldn't be doing my job if I didn't give a shout out to donate. Of course, becoming a monthly donor is really easy. And we have an amazing legacy program called the Circle of Hope. I also left some brochures up there about that, which is folks who have made plans in their wills or estates and left a gift to hospice. We've been very fortunate to receive some really nice gifts, and it really just helps us, you know, be more sustainable for the future. So with that, I will just take any questions. I feel like I ran through that real quick, but
I want to come up for a second.
yes, please.
I want to tell a quick story on a former member of us, Marilee by the River. She was the chief executive there at the time that the campus was developed. And when she first started, it was just trees. So who she called? Me. So I did all the permitting to take the timber stand off and do a conversion of the part of the ground from timber to campus. But the other part we could harvest because they have one of the most productive pieces of land in Humboldt County. They don't know this, but they do. These trees are 35 years old and they're like this big around. And so I did a selection harvest plan, which is a partial harvest. And so we got in there and we did this selection. Then Mary comes to me and she says, well, one of our estimates for roofing went up by quite a bit. Could we cut a little bit more? I said, well, actually, I went really easy on it in the first place because they have this, you saw the chapel in the slide, it looks out over the timber stand. So that's part of the ambience of what we're doing. We also did some safety. We got the trees back from the campus so they wouldn't hit the thing. But I said, yeah, there's actually been a change in the forest practice rules recently. So I could go down into the water course protection zone, and now I'm allowed to do a little bit more. Well, there were these legacy trees down there. So I could cut these 54 and 56-inch trees along with a few others here and there. And so we made it a substantial increase in the income from the timber harvest. And they, again, don't know it, but they actually could harvest that again in the future. Generate some more income. I mean, you know, the way timber works around here, basically you can harvest a stand like that, what we did, wait 15 years, you go back to what you cut. So you can cut it again. That's why we do selection harvest. But anyway, we have a tie with it primarily. I have a personal tie because hospice was involved with my mother-in-law, who was getting weekly care, but then she kind of recovered more than she was supposed to, and so now she's a phone call away, which we really appreciate. So anyway, I'm a big hospice advocate.
Thank you. Shout out to Mary Lee. I mean, she really was the driver of the capital campaign, and I mean, we wouldn't have that campus, beautiful place for our community without her. So.
And she was in our truck. They all know, and also spent years and years living in Mexico, volunteering with Project Eureka, and just was an angel when she was with us, and an angel when.
Absolutely.
Any other?
And I worked at Planned Parenthood for about 12 years, and I saw that all those trees get cut.
I did that too. For Danco.
And it was only because hospice was moving in that we were okay with it, because we were like, well, hospice is amazing. All right, we'll take it. Yes.
Well, thank you
All
very
right.
much.
Well, thanks for having me.